Hello, today we are going to discuss about erythropoietin, its production, mechanism, conditions that alter the production as well as a brief glimpse of exogenous erythropoietin. The word erythro means red blood cell and poietin means to make, so erythropoietin means a hormone that makes the red blood cells. Erythropoietin is a glycoprotein hormone produced in the kidneys by endothelial cells of peritubular capillaries in the renal cortex. A small amount that is around 10 to 15% of the circulating erythropoietin is synthesized by liver. However, in fetus, liver is the main site of production of erythropoietin. Small amounts of erythropoietin are also produced in the spleen, liver, bone marrow, lung, and brain. Liver is also the main site for inactivation of erythropoietin. Now, let us discuss about the mechanism of action. Erythropoietin exerts its effects on erythroid progenitor cells, stimulating them to divide and differentiate. Very early developing erythrocytes and some hematopoietic stem cells like CD34+ have erythropoietin receptors on their surface. Endogenous erythropoietin or its recombinant analogues binds to cells' receptors and initiate a cascade of cellular signaling that turns on genes that encourage cell growth and inhibit apoptosis, which is programmed cell death. As a result, the body's total hemoglobin and hematocrit are stimulated to rise. Let us discuss about the factors that stimulates the production of erythropoietin. Bear in mind, the background concept is when erythropoietin is stimulated, hemoglobin level rises and ultimately increasing the production of red blood cells. The factors that are potent stimuli for the production of erythropoietin is decreased red blood cells, like in the case of hemorrhage or in cases of hemolytic anemia. The second factor is hypoxia, which is decreased in oxygen levels in the blood. Besides, renal production of erythropoietin is increased by the hormone testosterone. That explains higher red cell count in adult males than in females. Physiological concentration of hormones like adenocorticotropic and adrenal cortical hormones stimulate the production of erythropoietin. However, in higher amounts, these hormones inhibit the production of erythropoietin. When we see the substances or conditions that inhibit the production of erythropoietin, the major condition is a person having a chronic kidney disease. The logic is in chronic kidney disease, the endothelial cells of the peritubular capillaries in the renal cortex are damaged. Since the production of erythropoietin is by these cells, the production goes down. This pathophysiology explains that anemia is commonly seen in chronic kidney disease patients, which persists with the administration of anti-anemic drugs. Why? Post your comments below if you know the reason. The other condition is transfusion of blood in a normal individual. These action decreases the rate of erythropoiesis. However, this is temporary until the normal red blood cell count is restored. Another thing is estrogen in moderate concentration are inhibitory to erythropoietin production. Recent development had caused the production of erythropoietin stimulating agents or ESA. There is no need to go into the fine details of ESA for an undergraduate medical, but you need to get an overview of it. ESA are harvested from Chinese hamster ovary cells and buffered with an isotonic solution which the provider can administer intravenously or subcutaneously. Depending on how well a treatment is working, dosage and frequency can be changed. This decision is made by a senior medical officer or a specialist. Just try to remember some adverse effects of administering exogenous erythropoietin. These are like substantial chance of thrombotic events, a rise in blood viscosity brought on by a faster erythrocyte production rate, a higher risk of myocardial infarction and ischemic stroke, and a higher potential for venous thrombosis. As usual, there are quiz questions. Pause this video and answer them. Comment your answers below. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.